Today we're here with Dr. David DeGotti of Suffolk Heart Group. Thanks for being here, Dr. DeGotti.
Thanks for having me, Tim.
So today we're going to be talking about heart health. So here at Zwanger-Pesisi, we offer a full array of cardiac exams. But today we're going to concentrate on one specific exam, CT calcium scoring. So Dr. DeGotti, cardiac calcium scoring. Now I feel like it's an exam that not a lot of people have heard of. Can you give us a little background about how the exam works and what type of people should be getting this exam?
Sure. So the coronary calcium score or exam is a test that's been around for approximately 40 years.
Oh, wow.
And it's had a resurgence recently because the American Heart Association and the American College of Cardiology in the most recent guidelines in November stated that physicians can use this study to help determine if somebody should be on a medicine or not.
So why is coronary artery calcium scoring so important, and what does it show us?
So the coronary artery calcium score is very useful because it can tell us if somebody has coronary artery disease years before it becomes a problem, in particular a heart attack or even death. So what we're able to do in a very short period of time is we can, with the use of very low dose radiation, scan a patient in about 10 minutes and give them an idea of what their risk is going to be in the next 5 to 10 years.
Oh, wow. So this is a buildup of calcium in your arteries? Is it calcium that's like the calcium in your bones?
Yes, it's elemental calcium, just like the calcium we have in our bones.
Okay.
But interestingly, when you see calcium building up in an artery, in particular the coronary arteries, it's a reflection of cholesterol buildup or atherosclerosis.
Oh, okay. So what is atherosclerosis?
So atherosclerosis is the buildup of cholesterol and plaque in the arteries, in particular the coronary arteries.
Okay. So now, calcium score, the word score, does that mean that you're getting a number and you want to compare it to get a baseline and see where you fall in, your likelihood of, let's say, a heart attack?
Yes, exactly. So when a patient undergoes a coronary artery calcium score, we give them a number, a score. And the number is a reflection of how much calcium do they have in their arteries. The more calcium a patient has in their arteries, the higher their risk of having a heart attack or dying from heart disease in the future.
Okay. So if someone does have a high score, now is there something that they could do to help prevent, having a heart attack or a stroke in the future?
Yes, and that's a great question because the whole point of the coronary artery calcium score is to prevent heart attacks and hopefully death from heart disease. And when we score a patient, depending on their score, whether it be 0 or higher than 400 or greater than 400, which is considered extensive plaque buildup, we can help people. We can prevent heart attacks and death from heart disease. You have to remember that 95%, upwards of 95% of heart attacks and cardiac death is preventable. But the sad fact is in the United States, and in particular on Long Island, 1 out of 3 Long Islanders dies from heart disease.
Oh, wow.
Every 40 seconds in this country, somebody dies from a heart attack.
Wow. So to let you know that Zwanger-Pesisi offers calcium scoring at multiple offices throughout our practice.